Hello and welcome to the SSF webinars. I'm Nathalie Boivin, Communication and Knowledge Broker Officer at the Société Santé en Français. It will be a pleasure to be your host for this webinar. Today's webinar is offered in English. I would like to begin by acknowledging that the land on which we gather is the traditional unceded territory of the Mi'kmaq people. This territory is covered by the treaties of peace and friendship, which the Mi'kmaq and Maliseet people first signed with the British Crown in 1726. The treaties did not deal with surrender of lands and resources, but in fact recognized Mi'kmaq and Maliseet title and established the rules for what was to be an ongoing relationship between nations. Now, a little overview of Société Santé en Français and our webinars. Oops. The Société, sorry, I'm experiencing some difficulty. There you go. Société Santé en Français is a national group of 16 provincial, territorial, and regional networks that are committed to improving the health of all Francophones and Acadians living in minority communities in Canada through greater access to quality healthcare services in their language. 3. The webinar objectives are as follows: improve access to new information, facilitate evidence-based decision-making, foster interactions between information providers and users. And the webinars are being offered with the financial contribution from Health Canada. Our speakers today are JoAnne Chalifour. JoAnne is a consultant with 20 years of management experience, specializing in French language services management in the community sector and quality assurance. Prior to becoming a consultant, she held leadership positions in health and community support organizations. She holds a Bachelor of Social Work from Laval University, a certificate in long-term care administration from Ryerson University, and is now completing a master's degree in management and organizational development at Laval University. JoAnne is involved in her community. She has been a member of the board of directors of the Francophone network of Southern Ontario since 2013 and maintains a provincial leadership role on the board of directors of the pan-Canadian organization Société Santé en Français. Our second speaker is Jacqueline Higgins. Jacqueline is a director of the Réseau Santé en Français from Terre-Neuve et Labrador, Newfoundland and Labrador. With a bachelor's degree in neuroscience from Memorial University and a master's degree in clinical vision sciences from the University of Montreal School of Optometry. Jacqueline has managed various research projects and clinical trials in collaboration with Health Canada, Institut Nazareth et Louis Braille, the Vision Health Research Network, and the Center for Interdisciplinary Research in Rehabilitation. Jacqueline also has over 3 years of experience in clinical program coordination, including roles coordinating optometric relations and intraocular surgery programs. In Montreal, Jacqueline managed one of the largest private intraocular surgical programs in the country. Returning to Newfoundland in early 2020, Jacqueline continued to coordinate the eye surgery programs until she stepped away from eye care to take on the role of the director of Newfoundland Labrador French Language Health Network. She now uses her project management skills to work towards the integration and improvement of French language health services in Newfoundland and Labrador. And finally, our third speaker is Geneviève Laferrière. She holds 14 years experience working in collaboration with various organizations to improve access to French language health services to provide quality, person-centered services to Francophone. Geneviève works with regional, provincial, and national partners to optimize, among others, the recruitment and retention of bilingual human resources, mental health, and senior services for Francophone. Geneviève holds a bachelor's degree in commerce with the University of Ottawa, with a specialization in international management and a project management certificate from La Cité Collégiale. Now, a few points of logistics. During the webinar, there's different ways you can participate and interact. During the presentation, you can interact with us in writing using the chat box or Q&A box at the bottom of your screen. There will also be polls during the session, so feel free to participate. All polls are anonymous and optional. As well, during the discussion session, you can either voice your questions by raising your hand, and then your mic will open, or you can use the chat box if you prefer to ask a question in writing. Now, without further ado, I'll pass it on to our speakers of the day. There you go. Geneviève, up to you.
Perfect. Thank you so much, Nathalie, and thank you everyone for joining us today to learn more about the eQuity Link platform and how it can support your French language services initiatives. So before we start, we have a little poll for you. Nathalie?
Yes, so the first question of the poll is as follows. Are you familiar with eQuity Link? Now you can only choose one option. Either one, I'm very familiar with eQuity Link. 2, I've only created my free account. 3, I'm aware of some of the resources and I want to learn more. Or 4, eQuity Link is new to me. Once you answer, please click on the submit so we can have your answer. Once 70% of you have provided an answer, we can share the result. And by the way, I'd like to say that today's webinar, during today's webinar, we have over quite a few participants from all over the country, from Alberta to Newfoundland and Labrador. So the results will be showing any moment now. So 75% of you, eQuity Link is new. This is awesome, because what a great opportunity for you to know more about eQuity Link. Thank you very much for being with us. For 16% of you, you're aware of some of the resources, but you want to learn more. This is right on. Now let's move on to poll number 2 now. You can see the question will appear on your screen now for poll number 2. The question is as follows. What is your biggest motivation for attending today's webinar? Only one option, please. Is it 1, my organization has a mandate to provide services in French and is looking for strategies? 2, my organization wants to address the needs of the Francophone and Acadian community? 3, I play a key role in planning of French language services, either at the organizational, regional, provincial, or territorial level. 4, I play a role in supporting organizations in the area of French language health services. Or is it 5, just by personal or professional interest? After you answer, please click the submit box at the bottom of your screen, please. So as I was saying, there's oh, there you go, you're quick answering the question. So the majority of the people today went for option number 1, which is my organization has a mandate to provide services in French, 28% of you. I play a key role in planning of French language services, that's 25% of you. And for 22% of you, you play a role in supporting organizations in the area of French language services. So thank you very much for answering these first 2 questions that provided us with a better understanding of who is behind the screen today. Okay, now I'll leave it on to Geneviève and her colleagues.
Thanks again, Natalie, and thank you everyone for participating in this poll. It's a great that we know that most of you are unfamiliar with the platform, so this will be a very good introduction for you today. So before we get into what the platform is and what it offers, just a little bit of background information. So Equity Link came from the need to provide better guidance for health, social, and community organizations wanting to develop or increase their French language services using various resources that were developed by Société Santé en Français, the French language health networks, or partner organizations. The initial goal was to demonstrate the existing link between three key national resources that were developed between 2013 and 2018. So some of you may be familiar with the Health Human Resource or HHR strategy, the implementation framework for health for French language health services, or the Health Standard Organization, or HSO for short, standard for offering for increasing access to health and social services in official languages. So after extensive research to further identify supporting tools and resources, adaptation for an online environment, and several consultations with various internal and external stakeholders, Equity Link was launched on March 31st of this year as an integrated guide to improve access to French language services and support organizations in French language service delivery. So what is Equity Link? It is a unique and comprehensive platform that supports the implementation of French language health services that is based on 20 years of experience in this field by Société Santé en Français and the French language health networks across Canada. It was developed by the French Health Network of Central Southwestern Ontario as lead network in collaboration with Société Santé en Français, the French health networks across the country, as well as various partners in the health sectors, and along with funding from Health Canada. It brings together several resources aimed to support the health workforce, health and social service organizations, as well as health authorities by presenting the ABCs for French language services, the where to start, the how to implement, and what to measure. Equity Link offers guidance in using the right resources at the right time, while adapting to various types of organizations, whether hospitals, community health centers, mental health and addiction services, long-term care, etc. And also takes into account the different stages of evolution along the French language service delivery journey. To gain access to the resources and tools, you must create a free account to be able to track your progress. So how can Equity Link support organizations meet their current strategies for optimizing health system performance? Well, Equity Link aligns with either the triple aim, which was developed by the International Healthcare Institute back in 2008, which is a framework for improving the lives of patients and supporting healthier populations while doing this at a reasonable cost. So these are the first three aims. And then in 2014, this framework was adapted to also include care team well-being as an additional aim. So this model can be applied to various parts of the healthcare system and all levels of an organization to foster sustainable healthcare system. So more specifically, if we're delving into each aim, Equity Link helps support the patient experiencing by improving by supporting active offer for French language services that is based on a person-centered approach and offers various strategies to support quality, safe patient-provider interactions. For improving population health, Equity Link helps organizations increase French language service delivery, therefore increasing access to appropriate services for Francophone and Acadian populations. It also supports active community participation based on the International Association for Public Participation, or IAP2 framework. And the tools and strategies are also adaptable for minority populations since it is based on a culturally and linguistically sensitive care approach. With regards to reducing cost, Equity Link offers a comprehensive project management guide that includes who should be involved and at what point of the process, a project management structure, a self-assessment, a customizable work plan and additional tools, as well as a way to track your progress. It offers tips, tools, and strategies all in one convenient location. This initiative also offers local tailored support that are provided by the French language health networks across the country. With regards to service delivery, properly addressing language barriers has demonstrated cost effectiveness, for example, by increasing patient adherence to treatment, more effective chronic illness management, reducing the needs for additional testing, and reducing the likelihood of up triaging. And finally, to support the care team's well-being, Equity Link offers tips and tools to support staff in French language service delivery. It includes strategies to support bilingual health human resources identification, recruitment, and retention. And it helps increase provider satisfaction by building organizational capacity to recognize the challenges for offering bilingual services, developing support mechanisms and tools, and ensuring proper communication, as well as recognizing the added value of bilingual staff can provide to meet the needs of various communities. Nathalie, up to you.
Yes, so we have another poll now. You see the question on the screen at this time. So the question is as follows. Has your organization ever implemented French service strategies? 1 answer possible. 1 no. 2 yes. However, developing a plan that was tailored to our organization was complicated. Or is it number 3? Yes. However, we struggled with implementation. Number 4, yes. However, we struggled with performance measurement and or evaluation. Or is it number 5? Yes. And our strategies generated sustainable change. So please choose an option and press submit at the bottom of your screen. There are 40 of us online presently, so this is pretty exciting. And like I said, people from Alberta all the way down to Newfoundland and Labrador. So the answers to poll number 3 are as follows. Ta-da! So the majority of you, which is 26%, went for number 3. Yes, however, we struggled with implementation. 22% of you chose number 4. Yes, however, you struggled with performance and measurement and evaluation. And as well, 22% of you said yes, and our strategy generated sustainable change. For 17% of you, the answer was no. And 13% yes. However, developing a plan that was tailored to your organization proved to be complicated. Thank you for answering our polls. Geneviève?
Thanks again, Nathalie. And thank you all for providing us with that feedback. So we can see that we really have participants across the spectrum of the implementation journey. And we hope to be able to address some of your concerns today by demonstrating the platform. So now I will just move on quickly to the platform. So here is EquityLink.ca. You can find the address right up here, and all the material that will be distributed after this webinar includes all of the hyperlinks for you to easily access the site and different sections. So as we can see, we are currently on the homepage. For new users, you will need to register for a free account. That way you can track your progress and see the different resources that you're accessing. Now, if we want to see if your organization is equity ready or whether you are equity ready, You can see that, as I mentioned, the target here is to address a lot of the language barriers that can exist in providing quality, safe care, and how to optimize this within the healthcare system. Now, as you can see, we mentioned that you can have direct support from the local health networks if you're struggling with implementation, with finding the right stakeholders to engage, and with support for adapting additional resources. As mentioned, the platform provides evidence-based tools from across the country, from different settings, and from international resources to support you with that implementation. It is flexible and it allows your organization to easily assess its current progress for French language services, where you are at in your journey, and identify key next steps that can be personalized according to your organization's current capacity, priorities, and also taking it one step at a time. As we mentioned, it can also be the tools and resources are adaptable to better serve minority populations, and for organizations that are interested in participating in the recognition program from Accreditation Canada, which is based on the HSO standard. All of the tips and tools are aligned with those criteria should you wish to move ahead with that recognition process. Now, if we go and consult our current resources, you will see that the site currently offers 3 different profiles to better guide you towards resources that would be of interest for you. We currently include eQuity fundamentals, which guides you with the support to implement French language services. It's basically the 101 guide that provides the link to all of the additional resources that are currently on the site. There is also the active offer training that is available online, and the health human resource strategy. These 2 resources, which you may already be aware of since they were in different environments prior to the integration and the links created through eQuity fundamentals. Now, today we will be focusing on eQuity fundamentals because it is the new resource. So when you are new to the site, and as you can see, you will need to click on take this course in order to access the different chapters of each resource. And just to make this quicker, I will log on my profile so that you can see the content. So eQuity fundamentals is basically the online adaptation of the implementation framework for French language health services, with the alignment for all of the criteria based on the HSO standard for access to health and social services in official languages. It focuses on 4 key steps to improving access to French language services. So understanding the needs of the Francophone and Acadian community, as well as your organization's current capacity, planning your organization's French language services with the right stakeholders, ensuring implementation of key strategies based on the 5 principles for equity for French language services, and making sure that you're evaluating or assessing your organization's progress. So in the implementation section, you will find the 5 key principles for equity for French language services, which are based on the different sections of the accreditation recognition program based on the HSO standard. So you will find active offer, clinical research for organizations that do conduct that type of activity, governance and leadership, workforce, and quality assurance. Now we'll jump ahead a little bit to the before you start section, because today we want to focus on how the website can help you better evaluate where you're currently standing with regards to the self-assessment and the French language French language health services planning tool. Excuse me. So the self-assessment tool aims to support organization quickly assess the current situation of their French language services, whether it be for a program, a department, an entire organization, or at the regional planning level. The tool takes approximately 5 minutes to complete, and you have instant access to your baseline results. Now, it is an online tool, but in order to support collaborative approach, we do have a PDF version that you can download or print and share with your current working group or committee in order to do that self-assessment collectively. Now I will go to the online version of the tool. So as you can see, this is based on my profile. We do have a self-assessment for doorways as well as other examples, but I will show you if when you're first starting, you perform a new self-assessment. So indicating your organization's name, you will find the same 4 key sections. So understand, plan, implement, and evaluate, as well as with the subsections for implement. So active offer, clinical research, governance and leadership, workforce, and quality assurance. So as you see, you get to assess for each of the sort of simplified criteria that are based on the HSO standard, whether it's something that, yes, you are currently doing within your organization, whether it's something that is currently in progress, or if it's something that has not yet been started. And once you submit your results, so I will just go back quickly to show you, based on the Doorways project, what you will see as a result. So every time that you log in, and you can save several different plans, as I said, whether by department, program, or for your entire organization, you will see your current progress from your work plan. You can always toggle back, or if it's the first time that you've completed the self-assessment, you will see your baseline data. So this will allow you to always be able to measure and compare and see how you're progressing along your journey, and be able to also track your progress and sort of get that little encouragement when you're seeing additional green bars and less of the red. And we also maintain clinical research for all organizations. This can either stay empty, or should that become a service that your organization provides, it can be adapted. So now, based on these results, you will see here you have access to how to personalize and develop your French language services plan. So if I go under the active offer section here, again, based on the Doorways project, you will find the same color coding within that region. So things that are currently being worked on for the organization, things that are not started, and activities that have been completed. So as an example, here we can open translate signage. So we know that, well, I currently know that that's something that has been completed. So we will take advantage and update this this criteria or this strategy based on the Doorways project. But if you're just starting and wanting to see how to adapt and determine which activities you're prioritizing under each of these strategies, you can access the more information section that will link you directly to the proper section of the platform. So you can see here, highlight the active offer of French language health services through clear signage in both official languages. Click here and see how it aligns with both the HSO standard, and we currently also demonstrate how it aligns with the Ontario Agency Designation Plan and Evaluation tool. We are also working to integrate additional criteria based on other jurisdictions across Canada where this is available. So you will see access to tips, different resources, whether at the national or various local level. So now, as we can see, you can include who is responsible, a start date, an anticipated end date, and any comments that you wish to track your progress. And since I have adjusted this to complete, afterwards we'll just remember to make sure that we are saving our progress. Now, if we want to show another quick example, we can see that the organization is currently working on their policies. So reviewing this, and for any of these strategies, you are able to change the progress status as often as you wish. You can take something that is completed and then put it back to in progress. Like, for example, if you are reviewing your current policies and procedures. So it is adaptable and can be used as on an ongoing basis to measure your progress. Now, if we just do a save, and we will go back to the dashboard. So you can see how it is, you have instant access to your results, whether it is your current progress or your baseline. All of the data is entirely confidential, so no administrator has access to it. It is strictly limited to your personal profile. It cannot be shared between users unless you create a shared user account with shared credentials within your organization. But there is a function to be able here to print your work plan. So this will send you directly to a document that you can either download or print and share with your ongoing stakeholders. So we encourage organizations to review their plan annually, use it as a tracking tool, and which can also support your other reporting needs, and make sure that you are continuing to use it to set new goals and achieve greater levels of access to French language services. So now I hope that you were interested in seeing this first demonstration of where of what the online platform can offer. And now I will hand it over to my colleagues Jacqueline and JoAnne so that they can share their experience with the online tool within French language service improvement initiative project.
Thank you, Geneviève. So today, JoAnne and I would like to talk about how we used the tools on the eQuity Link platform in one of our own projects in collaboration with the Newfoundland and Labrador government and Eastern Health, one of the regional health authorities. So essentially, the project started in 2018 with a collaboration between the Newfoundland and Labrador Francophone Health Network and the provincial government to assess the needs in terms of mental health services and improve access to those services for the Francophone and Acadian community in the province. So we started off with a needs assessment to evaluate the priorities of the Francophone community. And then we identified Doorways walk-in clinics at Eastern Health as a potential partner for the implementation of bilingual mental health services. So a working group was formed between members of the Francophone Health Network, the provincial government, and Doorways management at Eastern Health. So essentially, the goal of this project was to provide and create tools and resources to help support Doorways in the implementation of a sustainable bilingual mental health service. By doing so, we hoped to expand access to Doorways services to the Francophone community by also strengthening the French language services within the continuum of mental health care in the province.
Hello. So before I joined the group as a project manager, as Jacqueline said, the Francophone Health Network had commissioned a study to draw a portrait of the local Francophone situation and the needs of the population with regards to mental health services and existing resources. Based on this study's recommendations, the working group identified an opportunity to work with Doorways walk-in clinics in order to offer French language services. The Francophone Health Network supported its system partners by helping them to identify French language capacities of Doorways staff using this evaluation tool that you can see on the screen, which is available on eQuity Link in the Implement section. You can see it on this slide and on the following slide. Now let's move to the implementation plan. I started to use the platform in its very early implementation stages, and the option to generate an action plan was not yet available, so I developed my own. I used the tips and tools on eQuity Link based on what was relevant to our project. I presented the plan to our committee during a meeting, and it was accepted by all. The government official assigned to our committee said that while it was an ambitious project, it was achievable. So I created an Excel spreadsheet, which you can see on the screen right now, in order to have everything in one document: the implementation plan, the action plan, and the timeline. As you can see on the document, I use a color code because it's more visually appealing, and it's also fun to see our progress as we kept going. There was obviously more green and yellow and less red. So I also numbered the action items to make it clean and easy to see. And on the next slide, you will see my action plan. For the action plan, the template I used is divided by theme and is color-coded and numbered. It gives a step-by-step guide by section. Now, on the next slide, excuse me, you will see the timeline. So on the next slide, we're going to look at the plan. So I showed you the plan that was originally developed, but we had to readjust it around the context and what we could reasonably achieve with the time we had. The winter of 2021 was unstable, to say the least. Between the pandemic and outbreaks, the elections causing the absence of the government official on our committee and pausing our work for more than 2 months, we had turnover of staff and representatives on our committee. And although we felt it was critical to have an HR representative and human resources representative join our working group, we had difficulties recruiting someone. So we adapted and we created a plan that is concrete and achievable. We put the emphasis on bilingual posting, on the development of clear internal processes to identify French-speaking clients, French-speaking clinicians, and a process to match both. We also developed a clear process to access interpretation services. It was a close collaboration between the Francophone Health Network and its system partners. There was a lot of networking and sharing existing tools and support, and a strong engagement and leadership from Doorways. Now, how I always say eQuity Link helped us. Well, it's a starting point. So our health system partner needed help to know how to go about implementing French language services. So I used eQuity Link to situate our project on the spectrum and to know what our project next step should be. Based on our self-assessment, we determined that we needed to focus on the implementation section. Our working group had already completed some important work, planning work, and we used eQuity Link to draft our plan and equip our partners with tools. Lastly, what I love about eQuity Link is that it helped us find evidence-based tools under one roof.
So of course, no project is without its challenges. As JoAnne mentioned, the pandemic caused significant delays in the project, especially where regional health authorities and the provincial government were responsible for the pandemic response here in the province. We were lucky that they did remain engaged, but it did cause significant delays. We also saw an increase in mental health service requests, which led to Doorway staff and management being particularly busy during this time. We also had a very long provincial election period in 2021, again, due to the pandemic, in which the provincial government representatives on our committee had to temporarily remove themselves from all projects. Aside from the pandemic, as JoAnne mentioned, we had some difficulty in regard to human resources, as the recruitment and retention of bilingual healthcare professionals in the province is particularly difficult. So we needed more information on the HR policies for bilingual employees at Eastern Health, but also at a provincial level. Now, that being said, we had some very noteworthy successes. So essentially, every member of the committee remained engaged throughout the project. We found that the tools that we were using helped divide the service implementation process into really practical and simple steps. We were also able to easily adapt the plan based on constraints in our timeline, and we were able to further utilize interpretation services as one of our main objectives to make up for the issues with recruitment and retention of bilingual employees, and then explore long-term strategies for those human resource issues. We also noticed that the plan can easily be adapted to other services and organizations. So the Francophone Health Network actually used some of those tools on 2 other projects here in the province. And finally, the platform is very useful for French language health networks when it comes to supporting their partners, even outside the implementation of health services. For example, educating people on the importance of French language services and helping with policy development. So despite the few challenges that we had, the network and the Doorways Mental Health Project Committee remained engaged throughout the project. It was definitely a question of resilience. So I would particularly like to thank the Doorways management for their outstanding dedication and hard work to the project. We were incredibly lucky to be surrounded by an excellent working group of diverse and motivated stakeholders. So for the next steps, the network will continue to support Doorways in the implementation of bilingual services and also help to work towards the recruitment and retention of bilingual clinicians. At a broader level, the network will continue to work on tools and resources to help health institutions develop policies and procedures to apply when developing bilingual services throughout the continuum of care.
Thank you so much, JoAnne and Jacqueline, for sharing your experience. So based on today's presentation, we hope that you take away a few items with you as you move along throughout your day and through the days ahead and looking at your implementation of French language services. So the eQuity link offers you the big picture with regards to French language health services. eQuity Fundamentals provides you with that 101 guide that links off to with all the different resources. You have access to the self-assessment tool that helps you quickly identify where you are at in your French language services journey, identify your strengths, low-lying fruits, and suggested next steps based on the different levels of where you are currently working on within your strategies. And you can also access support should you need that within your region. And all of the online tools, the platform and the resource are made available thanks to funding by Health Canada. So it is free for health, social and social service organizations because of this funding that is guaranteed until March 2023. The tools can be adapted to your needs. So it's possible to use the online evaluation tool and all of the resources that are made available. Or on the other hand, if you currently have plans, like in the example of the Doorways projects, you can extract the content that is helpful for you to move things forward and continue to increase your French language service delivery. And finally, as JoAnne mentioned, it is the online platform provides the consolidated resources that have been proven to be successful in different contexts and demonstrated high potential to be replicated in other settings. So we encourage you to register on the website today. Visit it if you already are registered to identify the resources and to support you along your French language services journey, and to visit often because we are currently working on additional resources that you will be made aware of as soon as they become available. So up to you, Nathalie. Thank you so much.
Thank you, Geneviève, as well as JoAnne and Jacqueline for a very informative but as well interesting presentation of the eQuity platform. Now we want to hear from you participants who are behind your screen today. So I'm going to have you used the option raise your hand? And to the following question, do you see yourself using the eQuity Link platform in your area with your partners or your stakeholders? So with just as a count of hands, if you want to just lift your hands, just so that we can count how many of you feel that you see yourself using the platform. So there are quite a few hands being raised at this time. That's great. 1, 2, 3, 4, 5, 6, 7, and it's counting again. This is awesome. Thank you very much. Now, maybe we want to hear from you. We have a few 15 minutes left, so we really want to hear from you. But before we go ahead and allow you to lift your hand and ask for voice your own question or write your question using the chat box, maybe I'll have a question for Geneviève. The platform is the result of an awesome lot of work. What are you most proud of, Geneviève?
Well, that's a good question, Nathalie. It's hard to pinpoint a single item for which we're proudest within this incredible journey to develop the online platform and the resources. So I would have to say being able to provide that big picture for organizations to be able to take it step by step, but knowing where they're starting from, where is their start point, what they've already achieved, their strengths, and be able to take it step by step. I know it can be overwhelming when we're looking at all of the steps, but if you're taking it based on your priorities and your current capacity, just identifying a few simple steps, 1 or 2, if that's what's feasible for your organization, to be able to develop and adapt that plan. So the adaptability, the consolidated, the integration of the different resources, and the collaboration that we've achieved through various levels of partners with the SSF, with French health networks, with various organizations across the country that are from the health and social services sector, both at an organizational and at a health authority level, was a great achievement.
Yes, thank you for that answer. Now maybe I'll have a question for JoAnne and Jacqueline. Can you describe any current or anticipated outcomes you noticed through your work with the platforms, resources, and the Doorway project?
Well, of course, we used the platform and the self-evaluation in particular on my part to look at where we were situated in Doorways. Now, Doorways is fairly equipped in general now, and we're at a period of transition where they're learning how to use some of the aspects of the platform themselves and sort of go forward with the network in more of a support role. What I've particularly liked about it is its versatility. So we've been able to start to implement the same tools or similar tools and adapt them slightly for other services. So for example, we have a collaboration with another mental health service here in St. John's. It's a peer support organization called Channel. And we use some of the elements of our eQuity Link tools to start a conversation with them, get ideas flowing, and they've been able to successfully implement a French support line actually recently. So we've been very happy to see that it's easily adaptable to various different organizations, and not even just particularly mental health, but it's also a great education tool in general. So the Francophone network in particular, us, where I'm new to my role, there's a lot of things in the process that you don't necessarily think about, but is vital and important for making sure that the service is sustainable and will last. So that was one of the things that struck me the most.
Thank you, Jacqueline. JoAnne, did you want to add something or?
Yes, I think we also plan to use eQuity Link for the next step for Doorways project. So again, going back to eQuity Link to look at the next steps and where we're at and what should be our next actions.
Thank you. And we do have a question that maybe I will direct to Geneviève. The question is as follows. Once you sign on the platform, will you receive notifications on new elements being added to the platform?
Yes, so there is a push and we can communicate with our current users, as well as if you're currently not registered, there will be different communications. But the best way to be made aware of immediately as new resources do become available is to register with the platform. I also see that there is another question with regards to the new organizations that are working with Société Santé en Français for managing new projects that were funded for the 2021-2023 period. We do recommend that you link with the platform to see how the different resources can be help you achieve your results, and they are all linked with the priorities and the tools based on the Société Santé en Français and the French language services movement.
Thank you. And feel free to ask any question or use the chat box to ask or comment. Jacqueline, did you want to add?
Yes, I wanted to add to that last question. So one of the 2021-2023 projects is actually here in Newfoundland and Labrador, and we've had the pleasure of working with them on developing their project plan. And we used quite a few elements from the eQuity Link platform. In fact, the project manager on the project did the self-evaluation. We went through it together. It's been incredibly useful, especially starting a project from scratch.
I can definitely see that it is so thorough. All the steps are so well described, and I can see that it is being quite a bit of help. Definitely, yes. We do have a comment in the chat box from Lynn Rousseau, who said that the tools such as eQuity platform definitely is a great help when having to put together French services and organize for its delivery. Thank you very much, Lynn, for commenting on that. Maybe a question while we're waiting maybe for a few other comments or questions in the chat box or Q&A. I know you talked about the challenges and the good things with the eQuity. If I were to ask, what are your hopes for doorways and for access to French language services in Newfoundland and Labrador? What would you say?
It's a very good question. Well, we're definitely working not only with Doorways, but with Eastern Health as a whole. So Doorways is a mental health service within the Regional Health Authority. What we would like to see is collaboration on policies and procedures, particularly in regards to the recruitment and retention of bilingual employees. We find that in general, mental health services is one of those areas where having a healthcare professional that speaks your language, the same language as you, is incredibly important when you're talking about emotions, when you're feeling vulnerable, when you're in a crisis. So that's why we sort of focused on mental health services in particular. Now, that being said, Doorways clinics are also across the province in other regional health authorities as well. So we're hoping that the improvements and successes that we've had with this will encourage other regions to start putting together little action plans, again, very much based on the resources and the time that they have to put into it, but to start making those small steps to make their services more bilingual friendly, because interpretation services are already readily available in regional health authorities. So we'd like to see that utilized a little bit more as well.
Great. We have a question from Julianne Lanting. She's asking the following: how do I find my local network contacts?
So yes, I did write a response in the chat, but if you haven't had the chance to see it, in the Who We Are section, there is a map of the Canada with all of the the French language health networks that are identified. So there is a link and you can access by province or territory to find the contact information for your local network. In various sections of the platform where we reference the support that can be offered by the French language health networks, you will see that their name is always being hyperlinked so that you have easy access to their contact information.
That's great. Thank you very much. I see time is, we only have a few minutes left, but feel free to write in the chat box or Q&R if you have another question. Meanwhile, you see a poll there, a quick questionnaire to evaluate the webinar, today's webinar. So you see there are a few questions there for you to answer. Number one, the webinar allowed me to improve my knowledge of this tool for the active offer of health services in French. So pick the answer that suits you best. Number two, the webinar contributed to my reflection on the importance of the active offer for Francophone and Acadian community living in a minority setting in Canada. And please use that gray stripe along the box to scroll down to the question number 3. Following the webinar, I'm more interested in using eQuity link, yes, no, or other. And number 4, the format of the webinar made it easy to interact with the panelists. Again, a choice of answers. And question number 4, the content of the presentation was relevant. And again, once you're done answering the questions, do not forget to press submit. I would like again to acknowledge the contribution of Health Canada for developing the project and as well as offering the series of webinar today. Any last word, JoAnne or Jacqueline, Geneviève?
I'd like to add as well, I would also like to thank Health Canada for their financial contribution to the Doorways project that was also financed by Health Canada.
Great, thank you.
And maybe just quickly that, you know, thanks to the funding, to Health Canada's funding, health and social service organizations have access to free support to help implement French language service projects to increase access for Francophone and Acadian communities located across the country. So these are there's expertise across the country. There are tools that can easily be adapted within your organization. So feel free, reach out. There is also an online form right at the top menu for requesting help. Should you not know where to access your French language health network, we automatically receive that information and it can direct you to local resources to support your endeavors.
Yes, it seems like everything was thought of from that using the eQuity platform would be an outstanding resource. It's almost like a gold mine. Bravo, thank you very much, Geneviève and your team for designing that platform. JoAnne and Jacqueline, thank you very much for sharing your experience. This is inspiring. And we can see that definitely it is proven to be very useful and rather friendly to use as well, and providing excellent tools so that you can monitor, follow up, share the information, and really help the team moving along who's using the platform. Thank you very much, ladies, for your participation today. And for all of you who are listening to the webinar, I would like to invite you to follow us on the internet site or the social network. There are webinars being offered on a regular basis. The next webinar will be next week and will be a collaboration with N4, which is the National Navigation Network for Newcomers. And we'll talk about, it will be bilingual, and we'll talk about the health of Francophone immigrants coming to Canada. So thank you very much, ladies, and all the best. Longue vie to this outstanding initiative, eQuity Link platform. Thank you very much. Bye-bye.